Go home and suck dick and don't brush your teeth because you're gonna wake up with your mouth smelling funky. Who wants to be basic when you could be perfect?
That's right.
The
So-
baddest bitch on the podcast. I'm like, oh my god, is this a trend? I get it in. Are you ready?
So, welcome to my podcast. This is the Dr.D chair.
Thanks
Are
for
you ready
having
for
me.
it?
I am super happy to be here.
Okay, so who am I here today with?
Okay, so y'all already know I'm MARKLAND, one of the flyest, baddest Leos from Kingston, Jamaica, the baddest bitch on the podcast. And I am from Jamaica, as in the island Jamaica. So big up all them nice, clean Jamaican at y'all them.
All right, people already hitting me on the DM. We just uploaded a history, Instagram history, and people already going crazy, saying all Jamaican people excited to see you here.
I love my Jamaican people, and they love me.
Right? So, on this podcast, we're gonna pretty much talk a little bit of everything, you know. So let's get into it. So
Let's get into it.
Leo, right?
The best.
So what are those main things that Leo does that no other signs that?
I could write a book on this. One thing about Leos is that we're gonna put ourselves first.
Okay.
People may think that we're selfish,
Yeah.
but in reality, what Leos do is they put themselves on a pedestal, and for you to get there, you have to stretch and get us. So Leos, we're not gonna make people take advantage of us. The Scorpios, the Aries,
Right.
Aquarius, I can't say the same for them.
All right, but let me ask you something. So, are you getting veneers because of you only, or because what other people are gonna say about it?
It's always about me. It's always about me.
100%.
100% about me. People have never really spoken about my teeth before.
Right.
I had a really horrible gap.
Yeah.
And then I did braces in LA
Yeah.
when I was living in LA and got
Yeah.
rid of those. But I realized that when I talk, because I talk a lot,
No way.
I use my mouth a lot. When I talk, I don't really see my top teeth. And I
Right.
want to change that.
Right.
But it's always about me and what
Yeah,
I
you're
think.
saying it because of you, how you feel, and
It's
a
always
decision
about
that you
me.
made about yourself,
Always about me, Doc.
right? Okay, so do your friends know that you're getting veneers done or not?
Oh yeah. I'm really close with my friends, and shout out to everyone out there who got a bestie. I believe in this day and age you need a best friend, because my best friend supports every bad idea I come up with. They'll check me if I'm doing something out of the ordinary.
Right.
I'm like, hey girls, I'm getting teats and this is what we're doing. They're like, okay. So they're like, oh, do you want it? And they're like, of course, life is short, be perfect.
Right?
Who wants to be basic when you could be perfect?
That's right. So I was gonna ask, are they like pretty much now like waiting for the result? You know, like
Oh,
for
yes.
the outcome.
Every time I call them on FaceTime, they're like, let me see. I'm like, no, bitch, I'm just getting my teeth clean just now.
Right. Just yesterday that we're doing consultation, you
Right.
just were calling out. What was that, cousin?
Yes, my
Yeah,
cousins.
yeah.
So most of my cousins are my best friends because bitches are weird, so I keep
Right.
it in the family. Like I feel like with other girls, I feel like me, I'm Caribbean, so
Right.
I'm family oriented. With other girls, if you're in my life and you're fake, bitch, you gotta go. But my cousins, they ain't going nowhere.
Right.
So,
So
yeah, period.
you grew up in Jamaica and you moved to LA at what age?
So I grew up in Jamaica, and then after college, I went straight to New York.
Okay.
And then I moved in
to New York first.
Right.
Okay.
That's where most Caribbean people go, to New York
Right.
City. It's like the biggest melting pot for
Love
all
New York
the Caribbean people. And Latinos.
Yeah.
I love me the Latinos as well.
Cool. So getting into the veneer process and stuff, you know, I know pretty much all of you guys there have seen already the video of this guy here talking about veneer breath.
Oh my God.
What do you know about it?
A nightmare.
A nightmare.
So I don't know if you guys know me, but I hang with a lot of bad bitches. When I go out, I'm always like in a section.
Yeah.
Or, I'm with the fly girls and the
Right.
dope boys, like all the fly niggas go on a party with the Barbie.
Right.
But when I'm out and I meet certain people, I would never imagine their breath to be that stink. And I look in their mouths and I realize they have veneers. I'm like, oh my God, is this a trend?
Right.
Like, what am I missing here? Like, it was really hard for me to fathom that so many pretty young girls out there or fly, handsome men breath stink. Like, I take hygiene serious.
Right.
I don't give a damn how much money you have.
I know.
I'm not kissing you if your breath stink. And I'm like, look at these bitches. Like, these bitches got bust down
Right.
Birkins, Chanel's. And I'm like, bitch, how your mouth stink? It's not adding up.
Right.
And I'm realizing it's the veneers. So I
Right,
guess what
right.
happened was, based on my research, because I
Yeah,
made
yeah,
a
yeah.
video that went super viral
I
on
know.
TikTok. A lot of the comments were like, during the pandemic, everybody was just rushing to get
Yep,
veneers. I
yep.
waited because I had braces on. Thank you, Jesus. And then they never cleaned their teeth
Right.
properly. The doctors were saying that, oh, they probably had cavities and
Under,
they never
yeah.
cleaned it under, and they just put the veneers on
So
top of it.
you were pretty much thinking like that the veneer breath comes with the veneers. Pretty
I
much.
thought it came with veneers.
Right.
So I
It
was
was
under
part
the
of it.
impression like, oh, so everybody who has stink breath, everybody who has a veneer is gonna get
Right.
stinky breath.
Right.
So when I decided that I want to get my veneers done, that is my number one priorities. And I made up my mind, I'm gonna get veneers. But whoever doctor I'm gonna go to, if I leave this place and my breath stink, I'm like, baby, you gotta clean everything. Clean the back, the throat, the tongue,
Right.
the gum, everything, because I talk too much.
Right, and it is really important. Sometimes people are very worried about aesthetics, but I think aesthetics have to go really, by hand with functionality, but also with health.
Absolutely.
So it's not only the actual smell, which is not good at all,
But let
but
me-
what comes with them, because when it smells, it means also bacteria. So it's not only that smell, which is also, a turn off, but at the same time, like having that type of stuff is meaning that either the patient is not taking care of the veneers or the veneers weren't
So that's what I want to
properly
ask you.
sealed.
Is it a case where people would get veneers and the doctor did everything correct, but the girls are just not maintaining it properly?
Yes.
What does that look like? What does maintaining look like?
So patients, when they get porcelain veneers, they have to get every 4 to 6 months regular cleanings, and they have. I always say the best and most important clinic that you get is the one that you do at home. You cannot expect to wait or do a good job just a week before your cleaning appointment. You gotta do a very good job every single day at
And
home.
flossing
So,
too?
right. So twice a day. When you get to that follow up every 4 to 6 months, the dentist pretty much is gonna find everything clean and just do some normal and basic, nothing too much. So sometimes patients, they feel that once they get veneers, they don't have to do much
Right.
until they get the follow up 4 or 6 months cleaning,
I-
which is crazy. So sometimes answering the question is, can a patient have a veneer breath after the veneers were properly cemented and sealed? Yes. Now, I wouldn't call veneer breath. It's just a term that people use.
Right.
If you want to call it veneer breath, it's more like if you don't brush, if you don't take care of your teeth with or without veneer, you're gonna get a bad breath.
Now, do you also blame some dentists for not sealing and doing the proper pre-work?
I mean, I think I speak for my work, and
Right.
my job. I do know that some cases pretty much they're not sealing, they're not fitting how they should. But I think every dentist is
Different.
professional, enough to know if the veneers are properly sealed, properly cemented. But that's what we do here. We take aesthetics as serious as the health.
But there's a veneer breath epidemic going around now.
Yeah, that's true. Because, as I said, it is. I cannot say like half and half. Huh?
Veneer techs. Oh, right. So there's also
text.
so people
Oh.
who are veneer techs and not dentists, they're really a huge part of the problem as to why people mouth stinks.
Right.
So let me ask that question because that's good to put in the podcast.
yeah.
So, what do you think about these veneer techs? Because I just moved from Atlanta
Yeah.
because I lived there for like 2 years,
Yep.
and there was a popular veneer tech who just got arrested. Do you think they're a huge part of the problem as to why the girls' mouths stink?
I think I wouldn't say a yes, because I'm not saying that the problem of veneer breath is only because people that are not professionals doing or practicing dentistry or cosmetic dentistry.
Mhm.
But I would say like some people, that didn't go to school, didn't went to any dentistry education, most likely they just learned in few days how to do something that took me years.
Years.
Not only the 5 6 years that I went to dentistry school, but also after that, kind of like the learning process of already being a dentist, but finding your technique to find the sweet spot where everything is gonna, not only lab, clinic, and everything come together to do a really nice job, you know. So if you are learning that in few days, then I'm pretty sure that the job is not doing like good, you know, it's not getting done properly. And if the veneers are not done correctly,
Properly.
yeah, and they're not sealing, they are not fitting properly. So sometimes even if the patient is trying super hard to clean them really good, they're still gonna sting. So
Let me ask you this question. So you being a professional dentist, like you went to all these years of school, because I would feel some type of, it's like going Nicki Minaj. You doing all that sacrifice and hard work, when you see these quick veneer techs, do you feel like they should not be legal?
right, first of all, they're not legal. You know.
Oh, so they're not technically legal.
Yeah, they are. A veneer tag is not something that is legal. So first of all, they're not legal,
Oh.
right? So a veneer tag is not a thing. You know, they are not legal, right? And I don't think they should be practicing in people's mouths because it's putting your health at risk. You know, because if it was like getting your nails done,
You would choose a
or stuff
professional.
like that, in something like that, it's pretty quick and easy.
Right,
But
right,
you're
right.
talking about organs that you have in your mouth,
Your
that are
mouth.
connected to everything, your
Oh,
brain
God,
and everything,
doctor.
you know. So if you get a bad infection, if something goes wrong, you know, then you're on your own. So I feel that more than the aesthetics, which I've never seen a veneer tech doing a pretty good job, but let's say that it was good, right? Even though it was good, I still think that is not right because just the health and the science behind that, you know?
Let me tell you, I cannot play with my mouth. I talk a lot. This is my money maker. And for my partner, I use my mouth very well. I would die if I walk around with jacked up teeth or smelly breath. Moreover, smelly. Now, doctor, I'm kind of curious. 'Cause
Yeah.
I'm really against smelly breath. When you open these people's mouth and they call, like, has somebody ever called you and said, "Hey, I have really bad breath after my veneers. How can I fix this?" Do people call and ask that?
Not really. Sometimes as I said, sometimes it depends on the oral hygiene of the patient. I feel that some of the things that I would like to be in America, to have the patients closer to me, it's because I feel that a patient should have a really nice oral hygiene routine before
Veneers.
getting veneers.
Oh.
So sometimes when they come here and I see gums, I see the teeth, I can tell that
They don't
it's
take
not,
care of
it's, yeah,
themselves.
it's not the best job they can do.
So y'all need to stop drinking those Don Julios, eating those lamb chops that be stuck in your teeth, and then you go home and suck dick and don't brush your teeth because you're gonna wake up with your mouth smelling funky. So you can't be a baddie with a Birkin, you can't be a baddie with a Chanel, you can't be a dope nigga with a big bust down chain, a rollie, and your breath stink. I would rather hang with somebody who's poor, who looks regular with clean hygiene.
right. So here, pretty much what we're saying is, before getting veneers, just make sure that you're doing a really nice job on the cleaning. So when you get those, you're already keeping up with the cleaning. So I'm gonna ask you something.
Yeah.
If you could choose getting your veneers, right, and you can change only one little thing, one thing about your smile or your teeth, between shape, size, or color, you can change only one of those with the smile design.
Size.
Only the size of the teeth, and you will keep the same shape and color.
Yes. Because I'm gonna tell you why. You see those rabbit teeth I see people walking around with?
Yeah.
It's hideous. It looks crazy. And it just goes to show that with whatever cosmetic work we're doing in this generation, I think we just take shit too overboard. Y'all need to calm down. It's never that serious. Just do things to where it looks natural, but also enhances your beauty.
Yep.
Those big teeth, I would rather a natural color.
Right.
What was the other one?
So I said shape, size, and color.
Okay, I would take natural color or whatever color I
Right.
have, In terms of the shape, I'm okay with this. I'm not satisfied, but the size is very important.
Right.
Like, I believe that it can't be too small, but it definitely should not be too big.
Right.
Like those big things you got, you look like no.
So do you know that the prettiest teeth, the natural teeth that normally people have when they have really nice smiles is because the teeth are really nice size as well?
Yes.
I've never seen a really nice natural smile with small teeth.
No, I'm not against big.
Right.
I'm against huge.
Right. No, what I'm saying is normally when I see a natural smile that is really, really nice, is because they're good sized teeth. Normally when they're too small,
It looks
there's
like, yeah.
Yeah, it's not like the natural smile that would be like, wow, you know?
But you know the oversized one I'm talking about. though.
Yeah, no, for sure.
A lot of people have those.
Right.
They're the choppers. They're really big and they're also fat. What makes it so fat?
You're talking about natural teeth or veneers?
The veneers.
Oh no, the veneers. I'm talking about like the natural teeth. Normally they're good size, but with the veneers, it's a lot of stuff. But pretty much it's the technique used that makes them like bulky and thick and a natural look.
Color is also a big thing for me. Maybe I should have said color. Because nothing is more attractive than somebody with really nice white teeth. It just says so much about them. It tells me how you treat yourself and how you're gonna treat treat people. Like it's like once you're a clean person, I just feel like I give you so much praise.
Yeah, but
so color is also
yeah,
important.
but I think that you did good. You did good because if I would have to pick between those three for you, I would say size because I think the color of your natural teeth right now are pretty nice, right? And then the shape, I will still keep it if I can choose two or three, just one. I think the size, especially for the top teeth,
Yeah.
so we can enhance that. I think it's a really good.
You know what
choice.
happened? I used to suck finger when I was little. Like I used to suck my finger when I was
Yeah,
smaller.
yeah.
So that kind of erodes your teeth.
Right.
And messes it up.
Yep. So, final question.
Nice.
What are your expectations for the final outcome?
I just want my shit to look good. I just want to keep being a baddie, and I just know that you're gonna do a great job. And I just want, I don't want it to be like chalky white. I don't want it to be too pale. I just want it to be a nice size. And when I'm talking, I just want them to sit there and I just want, oh, where'd you get the teeth done? And it's TopSmiles.
Right. So I appreciate you being here. I know you're here because you trust us.
I
and
do.
then we're ready for it.
But you do my friends. One of my best friends, Rich Rush, you did her teeth.
Yep.
And they're like, I didn't even realize that they were fake. So that's why I know you're gonna do a really nice job. And you know what? Different folks, different strokes. Is that how you say it? Different stroke, different folks. Some people like the big, dramatic look, especially if they're like a bigger person. Some people like the Nene leak. Some people like the natural look, and it's whatever as long as it works with your aesthetics.
Right,
For
right,
me
right,
personally, I want them to be a nice size, and I just want it to be a very in between color.
All right. Let's do it. You ready for it?
Let's go.
All right.
This is a man. Oh, your podcast is